Today, ladies and gentlemen, I'll talk to you about confusion, delusions, and hallucinations, and also finally about a very interesting condition called schizophrenia. What is confusion? Confusion, if you recall, is basically when you do not know what is happening around you, look around, you don't understand, and you don't realize what is happening. You are surprised, bewildered, unclear. Then you've got a delusion. Delusion is when a person believes in something which is not there despite it being contradicted by reality. He says it is raining when it is very dry and he insists that it is raining. Then you've got hallucinations. This is when person hears, smells or tastes and feels things that are not there, outside his mind. Their voice is telling him and he's hearing them or she's hearing them. They're really frightening, and there is an identifiable clause. What I can say is hallucinations, delusions, and also confusion are due to change in the brain. A hallucination is, it is important that I tell you what is the difference between hallucination and a delusion. Hallucination is a false perception of objects or events and is sensory in nature. For example, a patient who's got Alzheimer's, he may have hallucination. They see, hear, smell or taste, and even feel something when it is not there. They may feel like the insects crawling on his head, or hear people talking to them and they respond to them. The delusion, on the other hand, is a false idea or a belief that sometimes it is something is a misinterpretation of a situation. For example, there's some people who are living with dementia. They think that their family members are stealing from them, or the police is following them. This kind of suspicious delusion is referred to as paranoia. It is important to remember that hallucinations and delusions may or may not be upsetting to the person living with this condition. But to the fellow human beings or society, it can be very, very disturbing because they can be accused of all sorts of things, that their money is being stolen and they'll start having arguments. So now I'm going to talk to you about schizophrenia, which is a very serious mental health disorder in which they interpret reality abnormally. Schizophrenia may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior, and it is on a daily basis and can be very disabling. And people with schizophrenia require lifelong treatment. What are the early signs of schizophrenia? A person is depressed, socially withdrawn, he doesn't talk too much, he's hostile, personal hygiene is not clean, he's got a very flat, expressionless gaze, inability to cry or experience joy or inappropriate laughter or crying. Patient may be oversleeping or undersleeping. He's unable to concentrate. You can see this is a rather complex condition, and there are several types of schizophrenia. There's paranoid schizophrenia, epiphanic schizophrenia, catatonic, residual, simple, and specified. You have to realize that sizable people with schizophrenia have to rely on other people because they cannot hold a job or care for themselves. And many of them also resist treatment, arguing that there is nothing wrong with them. Some patients may present clear symptoms, but on other occasions may seem fine until they start explaining what they're doing. Honestly, ladies and gentlemen, the effects of schizophrenia are felt far beyond the patient, family, friends, and society. I have to go a bit into the details because the signs and symptoms of schizophrenia vary. The symptoms, there are positive symptoms. Positive symptoms are psychosis, delusions, and hallucinations. Okay. Negative symptoms are the elements that are taken away from the individual. For example, absence of facial expression is completely blank. Then cognitive symptoms. Cognitive means that the person's thought processes are infected. They may be positive or negative. Person may be having very poor concentration. Emotional symptoms is basically blunted. He doesn't feel happy, he doesn't feel sad, he's just there. The other symptoms is lack of motivation. These patients, they don't have any drive. The everyday actions such as washing and cooking, I mean, they do not respond properly to any kind of emotions. With proper treatment, these patients can lead productive lives, but they need to be treated in various manners. You can use medication. It is necessary for medication, psychological counseling, and self-help resources. The psychotic medications are prescribed by the psychiatrist. The most common ones are for schizophrenia is risperidone, olanzapine, quetiapine, and ziprasidone, and clozapine and haloperidol. Now, these are primary drugs of medication, and they are prescribed by the psychiatrist. Sadly, compliance is a major problem because people with schizophrenia often come off their medications for long periods of time and they don't take the drugs. And then they have a huge personal cost. The patient must continue taking medication even when the symptoms are gone. The very first time a patient expresses schizophrenia, it can be very unpleasant and they may take a long time to recover, and the recovery can be a lonely experience. So it is very vital and crucial for you, for a person who is living with schizophrenia, he uses full support of you, your family, and other community services when it appears for the first time. I can tell you the tips that I personally use when I meet a schizophrenic. I never argue. Just ask simple directions if needed. If the person or enough persons and you keep agreeing with him, don't disagree. You call for help if you think if he's in danger. And you move the person or the patient away from the cause of the fear or from the noise and activity. And you focus on the person as if he's real. And three final tips which I think you can use when talking to a person with schizophrenia, you listen actively. It is important to understand that it is understood. To listen actively means to keep quiet and just nod your face and say, acknowledge the patient's experiences as a caretaker. It is important that you show you are sensitive and what your loved ones feel. And you try to uncover what motivates them. I think I've talked a lot today. It is a very, very complicated condition. I'll try to make it simple so that all of you can understand. If you have any further questions, please ask me or write to me or make your comments on my subscription on YouTube or on my website, rajivshori.com, and I will be more than happy to give you all the necessary advice. Thank you for today.